It's Dr. Rick, back again with another bulletin regarding the COVID-19 vaccination programme in our local area of Tameside and Glossop. Since the beginning of the programme, we've mainly had the Pfizer vaccine. This is the vaccine that needs to be stored at ultra low temperatures, around 70 degrees, and then as soon as it's thawed, used very rapidly. It's been an unstable vaccine, so it can't be taken from one place to the next safely. And that's why we've largely been using big immunisation centres such as the Hyde Pools or the George Lawton Hall in Moseley. But now things are changing. We're starting to see more of the Astra-Zeneca vaccine arriving. And this is the one which can be transported more easily and is more stable. So this is the week we really start to immunise lots of people at home. And of course, we're going to immunise the people who are housebound. These are the people who have mainly been shielding since last February and have disabilities such that they find it too difficult to leave their own homes. They're a really important but hidden part of our population and are usually very vulnerable to serious COVID infection. So this week, we're going to see NHS workers visiting people in their own homes aged over 75 to give them the COVID vaccination, as well as continuing with the usual programme for people aged over 70. The people of Tameside and Glossop should be really proud of our local health and social care workers because we are doing incredibly well compared to lots of other areas in the UK. We started our immunisation programme 2 weeks before Christmas and are getting through the population really well. And as soon as we get notice that new vaccines are on their way, we organise clinics to immunise more and more people. Such that over the next month, we're hoping to call up people who are clinically vulnerable, who are younger than the current cohort of age 70. So people with heart disease, diabetes, and other conditions which make them vulnerable. Now, one important point I must stress to anybody who is aged over 70 who has not had their first COVID vaccination is that nobody will be left behind. Your general practitioners know who you are. They know who's had the jab and who hasn't. And every time a new batch of vaccines arrives in our local area, we make sure we check our records to find who has not had the jab so far and invite them down to the clinics. So, for example, if you're over 80 and you missed the call up last time for people over 80, don't worry, we haven't forgotten you. Nobody is going to be left behind. We are so eager to make our society safe again and protect as many people as possible.